So I've been with L Health a little over 2 years and was really drawn to this company because it has such a unique tool, which we'll dive into later. But this food is medicine nutrition tool to help people improve their metabolic health and improve diabetes and a whole host of other things too that we can dive into. But my interest was in diabetes. So seeing the opportunity to work with people through telehealth, which helps you connect on so many different ways with all different types of people, and be able to see them make changes and see progress, see people go into diabetes remission. I mean, that's really kind of what led me here. And then now I still have some of my own members. I call them members, but patients. And then I do global training too. So it's been a wonderful opportunity to kind of expand my skill set, but do some of the things I'm just most passionate about. And that's really seeing change, increasing that health span or longevity, as we mentioned earlier.
What do you find? What kinds of things do you do when you encounter people with type 2 diabetes?
Yes, you're absolutely right. It's not the norm. In fact, just this year, we were at the American Diabetes Association conference in Chicago, sharing our real world data because there's a growing burden on the patient, on our healthcare system. So talking about this financial burden too of people with aging that have diabetes, and it puts them at such a greater risk for other comorbidities too, with
Yeah.
heart health that impacts that, nerve health, and most people with type 2 diabetes, at least 60% are on two or more medications. And so it's just this kind of cascading impact of how it um, side effects and the burden of keeping up with those medicines. And so it feels like the goal in type 2 diabetes right now is driving down that A1C, which is your average blood glucose over 3 months, whatever the cost may be, whether that's polypharmacy. Um, that's kind of what they're driving down. But what we're trying to do here is really not be band-aid healthcare and treating the symptoms but really treating root causes of age-related diseases, and diabetes is considered one of those. So we dig a little deeper, try to treat the root causes using lifestyle medicine too, to help reduce the burden, for help reduce the need for medication. So if we can help somebody improve their metabolic health and decrease medication while improving their A1C, that's a win. That's really what we're
Absolutely.
trying to do.
And how do you go about that?
Yes, great question. So we have this tool, the fasting mimicking diet. And I don't know, are you familiar with that, Christine?
I'm not.